Live Fit Podcast, episode 101, Natural Healing with Stem Cell Treatment with Dr. Joanne Halbrecht. In this episode, Dr. Halbrecht starts off by explaining what stem cells are and how they work.
Is they're signaling cells. So they're attracted to areas of inflammation or injury, and they signal the dormant cells in your cartilage to grow, and that's why it is a good treatment for someone with arthritis.
Then she says they're attracted to injured areas and they stop the chemicals that cause the inflammation, and
they also promote the inflow of blood vessels and they inhibit the formation of scar tissue.
She says that the results of stem cell treatment has been very impressive and it helps the body treat or heal itself.
As opposed to taking medicine that's just not treating the underlying condition. When we have diabetes, we take insulin, but that's not going to cure your disease. If you have high blood pressure, you take a medication for that, will bring your blood pressure down, but it's not going to do anything to change the course of that disease. But with stem cell injections, we can do something that's potentially curative.
If you've had damaged meniscus removed from your knee, there is still hope for regrowth. Dr. Halbrecht tells of stem cells working on a joint that had been without meniscus for 10 years.
And was bone-on-bone arthritis, and they showed MRI with them regrowing some tissue in that area. We're not sure exactly if it's meniscus tissue, but it's just showing the potential, even years out, of people to regenerate the joint and restore the tissues that were there.
Welcome to the Live Fit Podcast with Glenn Johnson, your resource for all things that contribute to good health. You will hear expert advice and interviews with leading authorities on fitness, food, fat loss, mindset, and the mind-body connection. You will find show notes, articles, and health programs at livefitpodcast.com.
Ah, yes, it is time once again for the Live Fit Podcast. I'm your host, Glenn Johnson, your guide to better health. Thank you, everybody, for listening. Please rate, review, subscribe, and most importantly, share this episode with somebody you care about. Now, on a more solemn note, today is December 7th, 2016. This is a day that will live on in infamy. Because 75 years ago today, the United States was attacked at Pearl Harbor, Hawaii, by Japan. 1,500 Americans lost their lives that day. I wasn't there, nor was I even alive, but as a veteran, a patriot, and an American, I'd like to have a moment of silence for all of our fallen soldiers, regardless of when or where or what service they served in. Though I was pretty lucky, I was in the Navy for 3 years and was not at a time when there was any battles, police actions, wars, whatever you want to call it, even terrorist things. So I was pretty lucky, but many, many, many veterans were not so lucky. I know people that have been in Iraq and Afghanistan, Pakistan, and just the things they've seen and the things they've been through, even if they didn't lose their life or a limb or have any physical damage, they still have that mental damage that really, unless you've been through it, you can't relate. I can't relate. I've talked to them firsthand. They've told me some stories, but that is, basically you might as well be watching a movie for as much as I can actually understand what it was like. Even though I was in the military, I get part of it. I can think I get it, but I really can't. And a lot of people don't even know that we're essentially at war still. And, I don't want to go off on a rant about this. I just want to express my appreciation for everybody who is over there now, over somewhere, serving their country, and whoever has served their country, because this is a great, great nation. I love this country. We can continue to be great, but we need to be together and really stand tough. I love this country. Let's continue to treat it with respect. Okay, moving on. I'd like to introduce my guest today. Her name is Dr. Joanne Halbrecht, and she's from the Boulder Institute of Sports Medicine. She is a board-certified orthopedic surgeon who specializes in stem cell treatments. If you have or have had any joint damages in your life, such as meniscal tears or arthritis, loss of cartilage, you are really going to be interested in this. But first, I'd like to read a recent review posted on iTunes by Interview Valet CF. They gave the Live Fit podcast 5 stars. Let me read what they had to say. And I quote, "Thank you for reminding me that no two people are the same with how we digest food and how our bodies respond to exercise. I truly appreciate the time Glenn takes to find relevant research to highlight what he is reminding us of." And I'd like to thank you, Interview Valet CF, for leaving that lovely review. It's really great to hear that I am helping you out. I'm hitting the target of what you're interested in. If you have not yet left a review, please take 2-3 minutes to do so. You can find a link on my website, or you can just go to livefitlean.com/iTunes, and that will take you directly there. But if you're on one of my show notes pages, there's a link down at the bottom. There's also a tutorial if you get confused on how to do it. It's not always as easy as it might seem. As always, you can reach me at glenn@livefitpodcast.com, or you can leave a voice message with a question or a comment. And if you have a question, I'd be happy to answer it on a future show. With that, let's get on with my interview with Dr. Joanne Halbrecht.
So I am an orthopedic surgeon. I have an undergraduate degree in engineering, and that's what brought me to orthopedics, is my love of science and biologics and mathematics. And so my interest in biomechanics brought me to orthopedic surgery. I did a fellowship in sports medicine for a year before I started practicing here in Boulder, Colorado, and I've been here for 20 years.
Wow, that's fantastic. And I notice you do a lot with stem cells and stem cell treatment therapy. Can you explain that a little bit?
The stem cell therapy that I do is after I've screened the patients carefully. A lot of patients that come to see me for stem cell therapy have been given a history of arthritis, and a lot of them haven't gone through other treatments for arthritis, such as activity modification, losing weight, taking anti-inflammatories. So I work with them first in terms of the other things that we can be done on a conservative basis, and then we look at other things such as steroid injections and bracing. And it's only then, if the patients had that done, that we look at using stem cell therapy as an alternative to further surgery, such as a knee replacement. I'm also using stem cell therapy in conjunction with surgical procedures such as meniscus tears and arthritis. Studies have shown that when someone has a meniscus tear and we inject stem cells, that this can actually regenerate meniscus, which was unheard of 10 years ago. And I'm also using stem cell therapy to promote the success of a surgical procedure called a rotator cuff repair. So when we tear a rotator cuff, we tend to be in our 60s, 70s, and 80s. If someone's 70 years old, the failure rate for a rotator cuff tear is about 40%.
Wow.
And this is because as we get older, our blood supply isn't as good. Our potential for healing isn't as good. When the tendon reattaches to the bone, it's mixed in with scar tissue, which weakens the repair. And so a study was done out of France with a 10-year follow-up where they injected stem cells at the time of the repair, and they showed a failure rate of 10% or less. And this is 10 years out, which is just quite remarkable. So the stem cells, many people have the misperception that stem cells differentiate, but they do that in the lab. They do not do that in the body. What they do in the body is they're signaling cells. So they're attracted to areas of inflammation or injury, and they signal the dormant cells in your cartilage to grow, and that's why it is a good treatment for someone with arthritis. It signals the cells in the lining of your knee that are producing these bad chemicals that cause inflammation and breakdown in the cartilage. They stop those chemicals from working, so they counteract them. They also promote the inflow of blood vessels, and they inhibit the formation of scar tissue. So that's why in that rotator cuff repair we have those stem cells promoting good tendon growth, inhibiting scar tissue, promoting the growth of blood vessels, and we really had some impressive results with the rotator cuff repairs. But even in the arthritis studies, we've got 2-year study follow-up with patients with osteoarthritis showing that about 75% without any further treatment, just one single stem cell injection, about 75% are showing persistent success and good results after the stem cell injection.
This is amazing news. How come I haven't heard more about this?
I think, we tend to see on news when some famous athlete has had stem cell therapy, and people don't realize that this is a procedure for everyone. And it's not like the rich and famous are the ones that are having this procedure done, or the retired professional athletes. It's the guy that works at the hardware store. It's the woman who's a triathlete in her mid-40s. It's the stay-at-home mom. And yes, it is a cash pay procedure because insurance does not cover it yet. But the results are just impressive in terms of getting us to heal ourselves, as opposed to taking medicine that's just not treating the underlying condition. When we have diabetes, we take insulin, but that's not going to cure your disease. If you have high blood pressure, you take a medication for that, will bring your blood pressure down, but it's not going to do anything to change the course of that disease. But with stem cell injections, we can do something that's potentially curative, and to prevent further treatment and further surgery and further deterioration of the joint. And so I think you'll see those few articles in papers with these retired pro athletes, but the word really hasn't gotten out in terms of what can be done for, just the average person. And I've seen shows on 60 Minutes where they show bad practices being done in other foreign countries. And this is the thing, too, is that we're injecting adult stem cells. Embryonic stem cells are really something that is not appropriate for the conditions that I discussed. And yes, people can go to foreign countries and get stem cell injections, and they don't have any idea what they're getting. They have the promise that they're getting embryonic. But again, really, we don't need that for the conditions that I'm talking about in orthopedics. And we can have our own cells harvested, and I tend to harvest the stem cells from fat because there's more stem cells there than there is in bone marrow, and the higher dose of stem cell, the better the response. And so just the word really hasn't been gotten out about how we're doing it successfully in this country.
So you take the stem cells from one person and put them back into that same person, just a different
Yes,
location of the body.
And that conforms with FDA guidelines. According to the FDA, we cannot use embryonic stem cells. We cannot use stem cells from another person unless you're doing an FDA study. You cannot take stem cells and grow them in a lab and re-inject them into someone else. But there are plenty of stem cells in your fat that we can harvest and re-inject, and the procedure takes about an hour. It's an office-based procedure. More commonly for me when I'm treating the knees, shoulders, hips. When we have a procedure that I'm doing, such as a cuff repair, I like to do that in the operating room.
So why won't insurance cover this?
There aren't enough studies now. They're just in their infancy. Studies started coming out probably around 2009, 2010. Before then, there were just a bunch of animal studies, and the government and insurance companies don't look fondly as results from animal studies to extrapolate that to humans. So now there are just more human studies coming out. Unfortunately, the stem cell companies that are making these kits to process the stem cells, really none of them are making any money. So it's hard to really get high volume, more doctors using it. And so we don't have as many studies that are out there to show its efficacy.
That is a shame. That really is. But I guess time will tell. You continue doing what you're doing as long as you still believe in it. And as there's more and more positive results, then I see it going nowhere but to the positive, with insurance companies finally accepting that it is worthwhile. What kind of side effects are there?
There really are no side effects. And when we look at FDA-approved studies, the first study that they do is safety. And we've shown that stem cells across the board are safe to use, that there really aren't detrimental effects. For me, in terms of harvesting the fat, some people have soreness in the abdomen from the liposuction, and I don't do a liposuction like a plastic surgeon does. We need a very small amount of fat for the stem cell procedure. And so there's just a little bit of soreness in the abdomen. What's amazing also about stem cells is they're antibacterial. So they kill bacteria on contact. And so when I'm injecting stem cells, and we don't have a risk of infection either. Wow. So, sometimes you'll get a little bit of pain at the joint that you're injecting, more pain from the harvest site, but there really aren't detrimental side effects from stem cell therapy.
Wow. It sounds like really a win-win there. And you had mentioned for meniscus repair. Now, I have a friend who had a surgery on a torn meniscus, and so, what they did was they removed the flap of meniscus. Is it possible for that to grow back?
Yeah, the study that was done out of USC was published in our most prestigious journal, the Journal of Bone and Joint Surgery. And they took a study where they had controls. A level 1 study is the best study you can possibly do. So you have a control group that was not treated. You have the doctor being blinded in terms of what they're done, whether he's injecting stem cells or not. And then it's also randomized. So this was a level 1 study, whereas double-blind, controlled, randomized study. And they found that the only patients that regrew meniscus after they had stem cell injections were the ones that had the stem cell. The control group did not regrow any meniscus at all. And the study was done with MRI follow-up. And in order to be a candidate for showing that you regrew meniscus, you had to have at least 15% increase in the meniscus volume. So again, your friend would have been a good candidate for that, because at least there's a potential to regrow meniscus. And for me, the meniscus is the most important structure in the knee. It's that cushioning between the two bones, the femur and the tibia, and that cushioning prevents us from getting arthritis. And when we have arthritis, then there's quite a slippery slope there. So if we can maintain the volume of our meniscus, then we're going to protect the cartilage. So if you remove meniscus, we're loading the joint more and have more of a chance of developing arthritis in the future.
Now, you said this in past tense. You said he would have been a good candidate. Does that mean it's too late now? Is there a cutoff?
The study, I like to be ethical with my patients, present studies, do things that there have been follow-up and good procedures done, and I'm not going to present an animal study as something that I can extrapolate to a human result. And so this study that was done was just with people who had meniscus removed, and it was a 2-year follow-up. And so if we look at doing the procedure, stem cell therapy, years later, we just don't have any studies that show that we can regrow meniscus. I was at a meeting in Italy a couple of months ago, and someone presented early results with someone who had meniscus removed 10 years earlier and was bone-on-bone arthritis, and they showed MRI with them regrowing some tissue in that area. We're not sure exactly if it's meniscus tissue, but it's just showing the potential, even years out, of people to regenerate the joint and restore the tissues that were there.
That is fantastic news. I'm really thrilled by that as somebody who is not getting any younger, and I don't particularly have knee problems now, but it's nice to know that there is something on the horizon. I mean, it's out now as you currently use, but it would be great if insurance would cover things like that, because it certainly could save a lot of money. Yes. In the long run for all this harmful medication and all the side effects that ends up damaging, the liver, kidneys, and whatnot. And still, there's really not an arthritis medication that really helps all that much. Some are more addiction forming, or some of the other side effects that people don't really want to have. So I'm really thrilled by this. If somebody's already had this damage, stem cells can help repair it. Do you have any recommendations for how somebody can keep their joints healthy, in particular the lower limb joints for let's say, runners? So
if we want to keep those lower limbs healthy, what we want to do is maintain a normal body weight, so a body mass index that's normal for your height. If we have a high body mass index, then we're going to load that cartilage more and cause breakdown of the cartilage. And the same thing with regard to our activity level. If we are doing too much impact activity, we can also do damage to the cartilage as well. When we're overweight, every 10 pounds that you gain above the waist, above your normal body mass index, puts an extra 75 to 100 pounds across the knee.
Holy cow.
Yes. And so we want to maintain a normal weight. We want to, especially as we get older, we want to do activity in moderation. So I love walking. That's a great sport. Running is wonderful, but I caution my patients, once you have start having problems, once you have swelling, arthritis, meniscus tear, then we need to look at toning down the mileage, changing the terrain, or possibly even changing to doing anything on wheels or in water.
Yeah, very nice, very nice. Yeah, I'm about 50, and I'm not a runner. I don't really like it, other than its practicality. And I do run about once a week, and I find that if I run any more often than that, I end up getting some knee or hip or even lumbar pain. So I'm primarily a cyclist, but it's not always practical to ride a bike. And I can go run this loop around my house in about 14 minutes, and that really suits me well for some daily exercise, among some other things here and there. But as far as the cardio, I really enjoy that. But the problem is these other pains that I just explained. Any recommendations for something like that?
So the question would be, do you stretch before and after you run?
Usually not before, but I do afterwards.
So stretching is really, really important. And I find that the majority of my patients who see me, particularly with knee problems and runners, hikers, people doing more impact activity, it's really because they don't stretch. They have pain because they have tight iliotibial bands, that band on the outside of the leg, because running really tightens that. Then it changes how your kneecap tracks, and then you start getting kneecap pain. And we can have pain all around the kneecap, not in just one specific location. And so for me, I have a lot of patients who'll say, well, the way I warm up is I run slow and then I run faster, but the running slow is really not stretching out the muscles and tendons the way they need to be stretched out. And we can avoid pain and injury by stretching before the run as well as afterwards. And I really emphasize the IT band, quadriceps, and hamstring stretches for that.
Okay. I stretch every day. It's just not always bookending my run, but I will pay more attention to doing that on a regular basis.
The foam roller to the IT band is the runner's best friend.
Yes, I love the foam roller. Yeah.
Yeah.
So you love biomechanics. I took a biomechanics class when I was in school, and I thought I would love it. And I think this was a case of the instructor spoiled it for me.
Yeah.
But tell me what you love about it.
I just love the motion of the body and how our biomechanics relate to our well-being, how different the way we walk, if we excessively pronate or supinate, and how that can affect your ankles, your knees, your back, your posture as well. And that's a thing that I advocate as well, is posture too, for all of my patients, regardless of age, because so many of us spend so much time in front of the computer.
Oh, yeah.
And when we're in front of the keyboard, we're hunched over. And then when we want to do our activities on the weekend, whether it's hiking, biking, running, or just working around the house, then we want our body to have good posture and to have normal mechanics. And because the muscles have been changed by what we do during the day, hunched over the computer, we don't have normal mechanics, and we have poor posture. And then we get neck, back, and shoulder pain because our center of gravity has changed. Your head's a little bit forward. The shoulder blades aren't where they should be. And then we start having problems. And so I'm an advocate of doing exercises where we can strengthen the muscles around the shoulder blade. And when we sit at the computer, we're sitting with better posture so that we're working those muscles out, so that when we're not at the computer, we want to do the things we really like to enjoy on the weekends, that we're not having pain with that.
Yeah, I definitely agree with that posture. I don't know if everything starts with posture, but that is a really good place to start if somebody's feeling pain. So, a lot of, the country's aging, and a lot of people are trying to renew their bodies after many years of sitting in front of a computer at desks, whatever they're sitting in front of. They're active as a kid and even in college, and then they get that job that they've been working so hard to get, and plonk, they kill their body slowly. And then they they hit their 40s and they realize that, holy cow, I'm losing everything. I need to get my body back so I'm not dead in 20 years. What kind of recommendations do you have for somebody who's now sees the light and wants to get their body back in shape? How can they do this safely?
So first, what I want to do is have people really look at what their weight is and what their body mass index, because now you're looking at a job, like you said, sitting in front of the computer that's more sedentary. And if we consume an extra 100 calories a day, we gain a pound a year. So that person who had optimal weight in their 20s and 30s, now in their 40s and 50s is 10, 20, 30 pounds overweight, because you're consuming more calories and they're not necessarily the good calories either. And then you're at a more sedentary position. So I'm an advocate of a diet that's low in glycemic index. And that's really an easy way for people to lose weight, is to stay away from those high glycemic index foods, the sugar, the white flour, the white rice, and the white potatoes. And if they can stay away from that and eat the whole grains, stay away from potatoes for the most part, have brown rice, cut the sugar out of the diet, then they start losing weight. And then if we look at activity level, even just walking, they did a really nice longevity study in Southern California. They started out with a community called Leisure World, and they had 13,000 people enrolled in this study. And this was a community where people had lived there in the 80s, filled out a questionnaire, and then they did the study more recently and wanted to find out who had lived into their 90s and what they were doing and how they got there. And so out of 13,000 people they identified, they were able to include 1,600 subjects in the study. And in the study it showed that people who lived into their 90s exercised at least 15 minutes a day, but no more than 45. So that if you exercise for more than 45 minutes or for 3 hours, it's of no benefit for longevity. And exercise was not high-level impact, not real heavy weightlifting. It could be just walking, or even gardening was considered part of exercise. And so if we look at, what's going to take us into the future, we don't want to, beat ourselves up. We want to do moderate activities, low load, have a good body weight, have a good diet too.
Well, that's fantastic. That's, of course, the sort of thing that you would expect to hear, but it's nice that it's not trendy. This is not trendy information. It's been around for a long time, and it shouldn't be a surprise to anybody hearing this that exercise on a daily basis is good. Keep the sugars down, so the white flours, the starches, things like that. But what's really interesting there is people tend to get, at least Americans, tend to get this mentality that more is better. And if exercising for 30 minutes a day will help you live longer, well, then exercising for an hour will help you live even longer than that. But that's not scientifically sound, is it?
No, we call that boomeritis. So baby boomers, that they get it in their head that, a lot of exercise is going to be really good for me. And I've had patients in their 50s present with knee pain and swelling. So had this happen, I don't know, I'm in great shape. Well, tell me what happened. Well, I was at a boot camp and I was on all fours going back and forth with my legs like I'm running, and then I felt a sudden onset of knee pain. Well, that's probably not the greatest idea as an activity for you to do in your 50s. And when I got her MRI, it showed that she had significant arthritis in her knees as well as a tear of the meniscus. And people are just completely dumbfounded that this has happened because they feel that they're in good shape. And good shape, we kind of have to put in quotes, because good shape doesn't mean that we're running 100 miles a week or exercising for an hour and a half a day.
No, and like I tell people, sometimes they'll bring up fitness and they'll say, "Oh yeah, that guy's fit," and they're assuming because this person does not have excess visible body fat that they're fit. But then again, I turn that around and say, fit for what? If you see somebody running, they're fit for running, but are they fit for swimming or rock climbing or lifting their own body weight? So there's different forms of fitness. And if you're generally a runner and then you take a boot camp class, there's a very high likelihood of becoming injured. Even I have done that in my 20s. We become injured doing something that I should have, quote unquote, should have been able to do. But since I took it at a level of somebody who's been doing it for a long time because I felt fit and strong, I developed some sort of little injury that because I wasn't being careful with a particular move that was new to me.
Yes. I've even had patients have meniscus tears from yoga.
Oh, really?
Yeah.
That's horrible.
Mm-hmm. I know, not thinking that an activity like that is going to cause an injury, but sometimes we bend the knee in ways that it doesn't really want to, or we already have cartilage in the knee that's a bit weakened, and then just bending it in the wrong way causes a tear.
Wow.
Yeah.
I've not heard that one. That one's pretty scary.
Yeah.
So what sort of things would you recommend for somebody if they really don't want surgery? Let's say they do have a meniscus tear in their knee and they really don't want surgery. And let's say you are saying that it's not necessarily operable. There's situations like that, correct?
Yes. So if I have a patient with knee pain and I get an x-ray and it shows a little bit of arthritis, then I get an MRI, and the difference between x-rays, it just shows the bones. The MRI shows the water content in the body, so we're going to see all of the soft tissue with an MRI. So then we get a better look at the detail of the cartilage on the surface of the bone, and if we see that that cartilage is really damaged, the cartilage normally looks like that white stuff at the end of a chicken bone, nice and smooth and thick. Right. But when we develop osteoarthritis, the cartilage breaks down and it looks like crab meat, or we can even have areas where there's no cartilage at all. And so when I see that person who has significant arthritis in the knee and the meniscus is just shredded, the meniscus is really shredded because the cartilage on the surface of the meniscus that's been rubbing on it has abraded the meniscus, and that's what's caused their tear. So I'll say to that patient, your knee is significantly arthritic. The meniscus tear that you have, if we operated on it, it may not relieve your pain. So the easiest thing for me to do is to give them a steroid injection. So powerful anti-inflammatory right in the knee. And I'd say the majority of patients who have some significant arthritis in conjunction with meniscus tear, this relieves their pain.
Oh, nice.
Yeah, for an extended period of time. Though I do have some patients, they have arthritis. They also have a meniscus tear. But a meniscus tear is more pain with squatting, kneeling, pivoting, and loading the joint, whereas arthritis is more morning stiffness, pain going up and down stairs, swelling with increased activity. So if I see a significant distinction between their symptoms, even if they have an arthritic knee and they're not really exhibiting symptoms of arthritis, it's more from the meniscus tear, then I would advise going in and cleaning up the meniscus. And again, I've had really great results, 75% success at about a year out with the patients that I've also done the stem cell therapy in that circumstance.
Oh, that's fantastic.
Mm-hmm.
What about crepitus? Any solutions for that?
So crepitus can have several causes. I find that a lot of runners will develop crepitus in their knee and not have any abnormality of their cartilage. It's really because there's a little fat pad in your knee that's right behind the tendon that attaches your kneecap to your tibia. And so there's a big pad of fat right there, and that will become scarred in runners just from loading the joint. And then you can squat down and hear this loud noise coming from your knee, and it's really just because of the fat pad. It's not like you have a damaged knee or any problems in the knee. And so I tell people, if it doesn't hurt, don't worry about it. It's just from running. Other people can have crepitus because they have rough cartilage, and they've got, instead of that nice white smooth cartilage that I was talking about at the end of a chicken bone, they've got a rocky road. And the rocky road tends to be more frequently found behind the kneecap as opposed to anywhere else in the knee. And when you load that kneecap, because that quadriceps is the largest muscle mass in the body, you're going to hear that cracking noise inside the knee because we don't have smooth cartilage surfaces rubbing together. And so that may be, like I said, in many of the runners, I'll see that they have tight IT band, tight quadriceps, and if we can loosen that up, we can decrease or relieve the pain around the kneecap.
Oh, that's very interesting. That's great to hear. Well, Joanne, thank you. That's been very enlightening. Did you have anything else you'd like to add?
No, I think we're good.
Tell the listeners how they can get a hold of you.
So my practice is the Boulder Institute for Sports Medicine. I can be reached at 303-449-8807, and our website is www.boulderinstitute.com.
And I, of course, will have links to that and others in the show notes page at livefitpodcast.com. Thank you very much for your time, Joanne. I really appreciate your insight about the joints. There's certainly something that caused people a lot of pain, both physically and mentally and emotionally. So it's nice to know that there are definitely some solutions on the horizon.
Yes, great. Thank you.
My pleasure. You have a great day.
You too.
Bye.
Thank you for listening to this episode of the Live Fit Podcast. Please subscribe and share with someone you care about. Read show notes, articles, resources, and learn more about our weight management programs at livefitpodcast.com. Once again, thanks for listening, and always remember to live fit.